Hello, welcome to Basic TCM presented by Lamp AccuWellness Foundation Inc. Our topic for this episode is lack of control and intertransformation. For lack of control, we have example 1. Yin is not controlling the Yang. Paroxysmal tachycardia, heart yin deficiency. Most of us have various deficiencies in different organs due to different reasons. Once an organ becomes yin deficient, it cannot control the workings of the yang anymore. This makes the yang quite unstable, rising high for short periods of time, manifesting acute symptoms of hyperactivity or hypersensitivity, irritability to light or sound, aversion to wind or heat. The symptoms disappear within a short period when the patient returns to the previous chronic deficiency state. Because these recurrent acute symptoms are predictable, they can be either prevented by tonifying the deficient aspect or treated in the acute state by sedating the excess aspect. Experience always teaches us to, when there is an option, treat the body when it is in a relatively healthy state, as opposed to choosing the time when it is very ill. This would be comparable to swimming with the tide and not against it. Next, we have example 2 for lack of control. Yin is not controlling Yang. One-sided, recurrent migraine headache. Liver, gallbladder yin deficiency. Local and distal points common to both states. We have GB20, GB21, LI4, and pericardium 6. This does not describe every case of migraine headache, but the recurrent migraine headache at the vertex or one side of the head, which comes on during stress after excessive intake of alcohol, with the start of menstrual bleeding, or because of exposure to excessive sunlight. It should therefore improve in yin situations such as during holidays and in the absence of stress, during the premenstrual days, or in the darker winter months. Still on lack of control, example 3. Yang does not control yin. Recurrent edema, kidney qi deficiency. So we have here chronic functional deficiency of the kidneys, which is kidney qi deficiency. And this causes recurrent yin retention, manifested as edema. Here you can see the difference between the chronic state symptoms and the recurrent state symptoms. For chronic state, cold feet, backache during rest, poor hearing, we tonify the kidney yang. While in the recurrent state, this is mild. So if there's mild edema, only in the ankles. If bad, edema in all joints or the whole body. In this case, we need to not only tonify the yang, but also sedate the kidney yin. Lack of control, example 4. Yang does not control the yin, so we have here a case of bronchial asthma, which is lung qi deficiency. Patients with chronic asthmatic bronchitis or emphysema that gets worse every winter season are prescribed more medication or get admitted to hospital. They can be treated extremely effectively if the lung functional qi could be tonified, and some general acupuncture points given to improve cough and breathing when their health is relatively better during the warmer months of the year. Next, we have intertransformation. For the first example, we have high fever. There is intertransformation from yang to yin. As you can see, there is high fever at the beginning, So initially, the yin would contradict or oppose. After 2 to 3 days of fever, yin is consumed and the patient becomes more dry, thinner, and weaker. And this causes a vicious circle. So this is a situation in which the yang has transformed into yin, thus increasing the yin. New symptoms: subnormal temperature, cold sweating, weakness, and lack of appetite. Here, the yin and yang are both deficient, but the yin is greater than before. The reason for this is that the yang has changed into the yin. This is a normal way for anything that increases to the point of extreme. It has to swing to the opposite side. Every day when the sun reaches its highest point, it starts its descent again. After the winter solstice, the weather changes to warmer, longer days and gradually to spring. The condition for the occurrence of intertransformation is that the yang increases to its zenith, not that the yin should be weak. But the yin would not have permitted the yang to rise so high had the yin been in a healthy state. Therefore, we see that if this change should occur spontaneously, the yin would have been deficient and not be in a position to control the yang. To understand this better, let us consider a patient with fever. Every time the fever rises, he starts sweating, and the fever reduces. But if the fever would linger for a few days, he will become more dry, weak, and even lose weight. All this being symptoms of yin deficiency. The sweating would be less than at the beginning. The fever will rise and fall, each time rising a bit more, till one day there is no fever but subnormal temperature, cold sweating, exhaustion, and poor appetite. The patient could need over 2 weeks to convalesce and would be very weak and ill following this fever. All this consumption of yin can be avoided effectively if we could have brought on the intertransformation earlier. How could we achieve that? We could achieve this by increasing the yang, by tonifying it on the first day of fever. This is done by using point Li11 at the elbow, which pushes the yang further upwards to its zenith, thus causing the fever to fall, while the yin is still in a healthy state. When the fever breaks, the patient will need only a few hours to return to their original level of health. This treatment is suitable for anyone whose yin is in a strong and healthy state, but it is not suitable for use in older, weaker patients with signs of dryness and yin deficiency. It should also not be used in children. Example 2 for intertransformation is manic depression. Now, this is intertransformation from yin to yang. So first, the patient cannot show anger, so the patient has a liver qi or yang deficiency. When angry, the patient suppresses and internalizes anger. So there will be depression, passive, rigid. This starts off a vicious cycle where the depression gets worse and worse until the extreme point of yin is reached. The yin will intertransform into yang, bringing on the manic phase. This example illustrates manic depression, bipolar disorder, in which the patient shows different symptoms and personality changes during different phases of the illness. During the depressive phase, he would be very introverted, passive, and rigid, and this period can last between a few days to months. In the manic phase, he can be extremely active, very opinionated about everything, very elated. That yang is very high because it is being fueled by the yin that was stored over the long period. The best time to treat the patient would be in the symptom-free period, or at the early depressive phase. During this time, they would respond well to liver yang tonification and regular physical exercise. These therapies would succeed in reducing the depression or in delaying the depressive phase. Thank you everyone for your attention and hope to see you on our next videos.